Happy Friday.
Hi.
Happy to be here again. This is exciting for me to do something with Bill. Taking my glasses.
Okay.
I don't need to pay too much attention. We're going to talk about summer, COVID. What are the plans? If you're like us, everything is pretty much fallen apart for what we're supposed to do over summer. And so it's this ongoing dread of what do we do with the kids. And as we're ramping back up to get into work and do things like that, our kids now are a little bit untethered. So I know you wanted to talk a little bit about not too much of nerdy things, but some of the official stuff on the same.
So in Arizona, we're not seeing a downward trend quite yet. That might be because they're doing more testing. So there's supposed to be some testing this weekend. The Arizona Governor Ducey, the Blitz. So hopefully some of that trend, we're seeing a slight tick up. That hopefully that's just more testing, not necessarily more disease. In Arizona, the fatality rate's about 0.8%. So comparing that to flu's 0.1%.
That means the survival rate, remember, 99 point.
Yeah, exactly. So the survival rate's still quite high. Obviously, the risk is over 65. There's still, majority of the deaths are over 65. So you have to be super careful if you're in that category.
Should we talk about kind of your thoughts on masks and things like that at this point?
Masks, I heard the WHO came out and said that only healthcare workers are to wear masks, but there's yet Arizona says everyone should use it. I think generally speaking, everyone should probably use it just to limit exposures.
So I'm going to talk just a second on the psychology of what I see happening is that there's a lot of misinformation. There's a lot of information that came out that said we should do masks, we shouldn't do masks. When you look at the global rates of where we're seeing the highest reductions, and typically it's more in the eastern countries where people are actually more akin and normalized to use masks for other reasons, pollution, other issues that they're dealing with over there. So they use them more and it's more common for them. So in the United States, when we had an issue of getting masks and all of these things, I think that it set us back from a psychology standpoint of do you or do you not wear masks? And now there's all of this misinformation between groups of people, or when you look at other people. And the psychology is there's this mimetic theory that talks about why things change and how they globally happen. And really people are kind of more herd mentality in the sense if they see other people doing it and it's accepted, they do that. So I think that, for me, it's looking at what does it communicate if we have masks on, and obviously when we're watching television or we're in these situations, like we're not seeing people in masks. But when you're out in public, you should probably see more people in masks, and the more people that start wearing them, I think if that's the safe trend to do, and I think that if we all kind of participate because it shows numbers are going down, I think that we'll start to see more people globally using them as we get
I think at this point, since we're lessening social distancing, I think masks, are more important. I read a study that if 80% of people wore masks, that was just as effective as a full lockdown. So I guess the question is, do you want a full lockdown again, or
we can't do that again.
Do you want to have masks?
Why don't you talk about the droplet thing? That's super interesting.
Yeah, I saw the article. So to get any virus, you need some infectious dose.
You're supposed to touch your face.
Sorry, that's right. It just has to.
Yeah.
So you need some infectious dose. So that means you need a certain number of particles, virus particles, to enter your body. Eyes, ears, nose, throat. And then you need some time exposure. So I saw this pretty interesting article, and it said you need about 1,000 viral particles to actually have potential disease of SARS. So to give you examples,
or some context, maybe.
Some context, yeah. And then so you need 1,000 virus particles, and obviously when you cough or sneeze, you release droplets. Those droplets could or could not contain a virus. So for an example, if you cough, you're going to release about 3,000 droplets. Those droplets go into the air and they obviously settle down pretty quickly. A sneeze has 30,000 droplets. And then a simple breath in and out contains 50 to 5,000 droplets. So the logic is if you have disease, which 50% of people don't have any clinical symptoms, is if you go by a person, if you pass by a person and they're breathing on you, are you going to get disease? Probably not, because one, you're passing them and it's 1 second instant of interaction. The likelihood of, even if they did breathe on you directly, that's going to be not very many droplets, not very many viruses. But if you're in the same room like we are in now, and I'm breathing and I'm talking and I clear my throat and I'm in this room for an hour, well then, okay, yeah, your risk actually does rise a little bit.
So Kim had a good question about, in Arizona, are numbers trending upward because we're actually doing this testing blitz, or are we actually seeing more infections?
Yeah, we don't know yet.
Great question.
Hopefully it is because we are having this blitz, so that would make a lot of sense. We'll start seeing more cases. But again, the more cases we have, it's reducing the denominator, which makes the fatality rate probably less than what we've initially thought it was. I mean, I've heard rates as far as 5% and then 1%, and now we're seeing rates under 1%, which is obviously great for everyone. So hopefully it's the blitz. But I guess in the next 2 weeks we'll know that, because the blitz will happen, we'll get more test results, and then hopefully we'll start to see a downward spike.
So quick question, probably not prepared for this question, and hi to our friends Tubios in Spain who joined us. We miss you. I would say that there's an issue in Arizona specifically because of the heat index, that people tend to spend more time inside in the summer months, don't they? So do we have other issues that we have to deal with that, like with you're talking about being in these rooms and ventilation and things like that? Or do you think that the social distancing and our ability to manage it, we're doing best practices, right?
Yeah, I mean, hopefully you're going to spend obviously you're going to spend time with your family, but again, your exposure to large groups like summer camps, I still think there's some risk with that, especially in the same room, and you have 500 people breathing in and out, and you don't know, there's probably a certain percentage of those, 5 to 10% that might be asymptomatic but have the virus. So it's a bit unnerving at the moment.
So I feel like I should have that music from Saturday Night Live, the wah wah, when you talk about, because we can't. So the summer camps, I think that there are a lot of people that are doing smaller groups. They're trying to salvage these situations. I think that we're probably a pretty typical family where like we are exhausted by the amount of time our kids are, bored or trying to struggle with, like, if they get back to a normal, like what that looks like. But we were talking a little bit about the psychology of being overscheduled and having downtime. And I think pretty globally, I think kids are often overscheduled and they're not getting enough sleep. They're doing things that push them to their limits. So if you've seen maybe a growth spurt in your child or some weight gain or any of that stuff, it could be that they're able to slow down a bit and they're actually getting that kind of restorative.
Yeah, I just talked to a parent the other day and they didn't realize how overscheduled their kid was until they realized, until pandemic hit and they basically have nothing to do. But I think, having a balance in life is great. Yeah, if they're bored, let them be bored for a little bit. It's probably good for them.
What about pools? Like, how do you feel about that as like for summertime? It's like swimming. Is pools, are they safer because of the chlorination versus lakes? Like, is there a water issue? Like,
I don't think there's a real water issue. I think it's really, there's been some recent studies that maybe it's not as infectious if you touch things versus actually it's a people thing. So I think if you're limiting your exposures to people, not zero, but have small groups, and have a few kids, the pool doesn't really, I don't think it makes a big difference. It's chlorinated. It's not at a level that's going to kill the virus, but it's more time exposure and people interaction.
Yeah,
unfortunately.
So with younger kids, I think that if you're struggling with that, again, they don't maybe have the understanding of it. And as we learn more information and as things come in, we're learning things as we go. And so over summer, getting some of those ideas out. I've been working with a lot of the education people on the psychology of where kids are right now, which is not a great place. One of the most recent studies I saw that was that our suicide hotlines in the United States are up by 800%. So there's a lot of challenge with adults, with kids, with just having the lack of certainty of like where things are, if they've lost jobs. I think that there was another shooting this morning. I think that understanding that we're all kind of at this very tense point right now. So if you can get a plan in place, in fact, we were talking about the American Academy of Pediatrics this morning. They're really backing down from using the term screen time because, of course, here's where we are. We're all behind a screen generally, but this isn't something that we're behind a screen bringing in content that we are wasting our brain matter on. We're being creative and we're being thoughtful and we're communicating with people, getting messages, which I love when you send them in. So those are the things that I think are important to remember with your kids. Is it's not as much about screen time, but what is recommended now is really more about, are you planning it?
I mean, I think the whole point is we may have been overscheduled before, and now maybe it's swung to underscheduled.
Yeah.
And so I think you have to implement some version of normalcy in schedules for kids. I mean, we're having our kids do an hour or two of some math, reading, something, because school's coming back in the fall. Aren't they anticipating a grade level drop?
Yeah, so typically there is from the educational world, and Kim, feel free to weigh in here, but I think that they always anticipate what they call as a summer slide. And so what they're talking about at the administrative levels now is, what is this COVID slide going to look like? And I think even to add a layer to it that I am trying to encourage them to remember is that when kids come back, it's not just going to be the lack of academics that they had over this last period of time, but it's actually going to be the fact that we communicated to them that your grade can't drop in many ways. So those kids that had A's and B's, I've got a lot of friends that are teachers, said that was like, kind of the death toll of like, all those kids were like, oh, I'm good. Like, my parents are going to be happy. So
except Lila, our daughter, was super intense on completing every project.
Well, I may have told her that messaging wasn't real.
Oh, okay.
Like I may have and I put therapy dollars away for my daughter so that she can get help if but I think that's where I think administrators aren't thinking about like the psychology of training them that when it's virtual, it doesn't count. So we're going to have that part that we're going to have to come back on. So that's why I thought it was important for parents, for us, for our family, and I would encourage other families to create some semblance of, whether it's Khan Academy or something that we can weigh in and give them some academic structure that counts, that we hold them accountable to, because we do need to train them back. Otherwise,
well, they lost 2 months of school of whatever grade they're in.
Right, and they're going to have some trauma. They're going to come back and they're going to be sad. So you read it. There's a comment. Did you read it? You have the glasses on.
The flattening of the. I've heard this question, somewhat like this question before, but the flattening of the curve was intended to save the hospitalization rates, and for us, like going to the hospital and like, okay, you're sick, I don't have a ventilator for you. That's obviously the worst case scenario. So the flattening of the curve, all these things we've done, flatten the curve. That still means the same amount of people are going to get sick from this. It just flattens the curve and spreads it out so that the healthcare industry can manage this. So we're going to see a drop in cases, but it's not going to go away. And the likelihood is, when flu comes around, we're going to see a bit of an uptick. So I think we'll have to be prepared for that. And doing these masks, I think, is the best thing we have, in social distancing as much as we can while we open up the economy and have people have jobs again and be able to afford food again
and I mean, and staying local shouldn't be a bad thing in that sense. Again, like if we're going to look at it from a community standpoint, like if you're living in New York, it's very different than living, outside of Phoenix. Like it's just the metropolitan areas and the densities are so different. So if our new normal is going to be through these guidelines of 6 feet and restaurants at 50% capacities and things like that, I think that we have to go in and we have to have some trust in that. The psychology of understanding it from people's standpoint is, I explain it typically as after 9/11. After 9/11, like, which we had this huge event and trauma, like as Americans, we all came together and we all came in and we supported one another and we were united against an outside force. And I feel like in this situation, kind of like how TSA got set up, we all kind of grumbled and we're like, we have to take our shoes off and things like that. But we all came to a consensus and understood the why behind it. And then that's a new normal. I feel like the masks and the the situation of social distancing and trying to really protect us at least until we can get vaccines on board and figure out like what's happening with treatment protocols and things like that, standard treatment protocols, that's just our new normal, and that we have to understand that psychology of like just kind of doing what our community is doing and supporting one another and uniting again, which I feel like is super hard during a summer political year. You know, I think that's part of our challenge right now is like figuring out like where people are so used to being divided, at least on kids, COVID, families. Like we need to unite and support one another and respect each other in how we're addressing this.
Yes, and everyone has different risk tolerances, and I think that's why maybe you're seeing some people not wear masks. I mean, they obviously maybe they have some misinformation too. That's possible. But obviously, again, if I was a 70-year-old guy with high blood pressure and a heart attack and COPD, I would still be quite concerned. If you're a 10-year-old boy, I mean, the likelihood is you're going to be fine. But these are all likelihoods and risks and obviously benefits. So.
Sue has a question about like testing and lag times. I think that originally at LifeScape we had like a 2 to 3 day turnaround on testing.
That was on antibody testing, and now Quest. Yeah, we had some of the times I order this test and it comes back in 3 days, and some other times it can be 10 days, which seems a bit ridiculous. But obviously that is the way it is at the moment. Obviously, the more testing we do, the more supplies that are taken up, and that will delay results.
So, but from a standpoint of like, have you heard from the medical community that over the summer, like, so how many times should we be tested? Like, so if we're over the summer and we're going to start to go into a new norm, if you have symptoms now that we go back in and we do testing?
Well, obviously, if you have symptoms and we're trying to figure out, and you have some risk factors, we want to do testing to figure out. I have trouble playing the video. I lost my train of thought.
Oh. Welcome to my world, but I lose our train of thought. So the new normal that we're playing in that situation where we're actually in a place where, like, I think the public needs to recognize, right, that where we are globally as a community supporting one another, and testing is going to be delayed sometimes, it won't be, all of those things.
I mean, if you're being tested for coronavirus, obviously we don't have a lot of medications at the moment to treat that with, so it's going to be basically quarantine and from as many people as you can. So I don't know if management would change if you knew you had coronavirus immediately, because there can be some false positives too. I mean, there would be false positives, there would be false negatives. So a lot of times we'll consider doing repeat testing at some interval, because if you have 2 tests that are negative, then obviously that's a little more, has more power statistically than if you had 1 positive, 1 negative.
Yeah. Which is all like, so again, his world of like the numbers and the statistics and all of the things that you read, super exciting information, like, and keeping us on to date, which is, I'm not trying to be super facetious.
That's right.
Okay. But the psychology of where I think the summer should be spent from my side of it is recognizing that this is truly a trauma and an experience that in my field we're looking at, is this going to be an adverse childhood experience? We call them ACEs in psychology, but like, is it an adverse childhood experience that our kids are going to be going through? And how do we get ourselves under the umbrella of security? And how do you create and potentially have teaching moments around resilience? And what does it mean? And so if you're within a house, if you're going out and you're taking the kids somewhere and you're not wearing masks, and I go out and I'm wearing masks, and the kids are looking at us and they're like, well, Dad doesn't wear masks, or all of
That's
this.
That's not true.
Well, no, I'm just trying to create a little controversy here. Okay. But like, to be aligned and just hold that line with your family, and again, like, we can't say you have to wear a mask, but I will say that the psychology of where you as a family divide out, those people that are under your roof are under your roof. Those people should be safe, right? But I think that, again, during summer, I think I would spend really quality time. An example for me would be, puzzles, because I like doing puzzles. Not really anybody else in the family, big fan.
I think Lila kind of likes them.
the kids like to play Twister
Yeah.
and see how twisted, like how
Yeah, but these are
unflexible you are, maybe.
but these are opportunities where I'm pretty flexible. These are opportunities where I don't think the kids knew that you liked puzzles
Oh, that's true.
until recently. And this is kind of a cool thing. Like, hey, mom likes puzzles. They'll remember that when they're 30.
Yeah. So, but I think having conversations about how you feel, having conversations about what's normal. So in this situation, I feel like, having, it doesn't have to be clinical diagnosis of anxiety or depression, but like having some moments of angst or uncertainty, or having some moments of sadness, or where we are feeling like a little bit untethered or irritable. You said that about our kids last night. You said you thought that they were maybe getting tired or
something.
Yeah. Well, I mean, yeah. So, but that irritability might kind of demonstrate that there's a little bit of uncertainty for them because their summer has been pretty hijacked.
Mm-hmm.
And so I think it's understandable to sit down with them and say, all right, let's think outside the box and let's be creative on like what we can do over the summer.
And admit it's sad. And yes, we have to transition. But again, resiliency, right? This is
right. Well, resiliency is like getting stretched out or getting put in an uncomfortable or difficult position and getting, rebounding back to that center. And your center might be a little bit different. They might be stronger because of it. They might understand it a little bit more. But I think that having those check-ins more often than not, and having a little bit more tolerance. I think that there's been there have been a few battles that I'll sit down with Bill and say, like I may have handled that slightly differently.
Yeah.
I feel like every moment doesn't have to be a fight. I think that we can definitely let certain things slide because we're a little bit unhinged a little bit in those situations.
Yeah. Should everyone be tested because of asymptomatic? I think we needed to do these testing to figure out what our denominator is, meaning how many people are actually getting the virus, how many people are having to go to the hospital, how many people are having ICU and ventilations and deaths. So I don't know if everyone needs to be checked. I thought it was interesting to do testing in our family, mostly because of my exposure. Excuse me. But not everyone needs to be tested. I mean, I think the testing is there to figure out, okay, how is this virus attacking Arizona or Phoenix or Maricopa County, and what are the numbers? And then we can make better decisions on everyone getting back to some sort of, getting back to work and everything.
So there's a really good question from our friend Mar about what do you do with kids that might be scared about getting sick and going back to school or that's like adults going back into restaurants and things like that, where that there is that part of like, am I going to get sick or not? And it's so interesting to me, and you can speak to the medical side of this, but from a psychological standpoint, it's you drop your kids off at school and they could get lice, they could get hand-foot disease, they could get flu, they could break something so I think that there's this kind of inherent exposure in the world that we put ourselves in front of on a day-to-day basis, and we don't necessarily always like think through. I feel like it's been that the COVID virus has been categorized as something that's like that because it's so unknown, that we need to be more fearful than other diseases.
I think initially we had to do that because we didn't know the mortality rates. Now we're getting more data. Now we're getting more data, and we know kind of how it's obviously a little more infectious than flu. It can kill more people than flu, but it's not as bad as Ebola or some other things.
So do you, from a medical standpoint, you're going back in and there's these articles, of course I'm, try to stay on top of it. And so one of the things that frustrates me so much is we'll have, a really big organization do a story on one kid that may have gotten the COVID virus and then there's pediatric inflammatory something, right?
It's scary to read that stuff.
It's scary. So can you talk a little bit about to me, it reminds me of the milk carton abductions that happened in the 80s.
Yeah.
Right? So does anybody, maybe we're the only ones this old.
No.
Okay, so they used to put pictures of kids on the milk cartons. And so everybody was really terrified. I know I was very terrified about being the next kid. And then I would sit there and pour my cereal and look at this milk carton. So I feel like there's a little bit of that. I don't know, from a medical standpoint.
Well, I think the news sensationalizes a lot of these things. Still, overall, majority of risk is, unfortunately, people over 65, and people under 20 are probably not at risk. They're not at risk. They're at low risk.
Okay.
0.1% of those people will get sick. So 1 out of 1,000 20-year-olds will get ill and die. I mean, that's always a potential. But the risk is still, again, like you said, 99.9% of the time they're going to be fine.
Yeah.
And it is hard to. I mean, I think adults have trouble figuring out risk. I think kids are even more troubled by they don't have to assess risk. How do you assess risk as a kid?
And so I think that, Mar, to your question, I think like looking at the environment, I cannot tell you the nightmare that's going on behind closed doors and at these administrative levels. If you think about the differentials in schools, there's some schools that no longer have windows in the classroom. There's some schools that may have poor HVAC systems that are 25 years old that have been limping along. What are the ventilation issues in those campuses versus a new campus that might have better ventilation but doesn't have a window that opens? And then how are we going to do contact tracing if a kid comes in? Probably very similar to the situation where you're going to have kids that come in with the flu or some sort of like I don't know what other viruses we get notices when that come home, but
strep.
Yeah, strep, things like that. That they'll have to notice this at home. So I think that the fundamental logistics of where the education system and the protocols that are getting put into place are going to be fundamentally different. And I think that we have to probably teach our kids that life is about going into situations and really monitoring yourself. I've always said that to the kids. Are you comfortable with what your choices? Like, are you doing that? So when you go into, let's say, a gym that might have wipes on every single machine, and they now have like gym monitors that are going around and they're checking to make sure people are wiping down their machines afterwards. That's a gym that's looking out for the people that are trying to return back, and they're trying to create new protocols versus one that might not be doing that. And so if you go to a gym that's not doing those protocols, like maybe you wouldn't feel so comfortable. So
speak with your dollars. I mean,
right,
change gyms or
right. But with school, I think that it's fair as parents to maybe lean into the PTO a little bit, to be an advocate on behalf of you, or to have conversations with your kids. How do they manage control with themselves? How do you teach them that's like kind of hygiene stuff of like, how do you do best practices? We're not going to share drinks, hopefully. I mean, you shouldn't have been doing that anymore.
Yeah.
We don't want to create a bunch of kids that are like germ phobes or hypochondriacs as they get older.
I don't know. I mean, I think it's going to change. I mean, people are going to be a little more vigilant. I don't know if that'll last for a year or two and go away.
Like to the level of hypochondriacs?
No. I'm just saying, generally speaking, our kids are washing their hands more. They're more conscientious. So that's probably a good thing. Hopefully it doesn't lead into something else. It could. I mean, obviously it could.
Well, and I think that it's important to, when you're dealing with a kid who's struggling or putting in like information, bless you. The one thing he said he was going to try not to do is sneeze on camera.
I sneeze in here.
Yeah. Well, you want to show them your technique that's safer?
Just this.
Yeah. So one thing you can do is affirm their feelings. Yeah. So, in those situations, like, make sure you address that.
And should everyone be tested because of asymptomatic? I want to go back to that question because Colton, my son, we got tested and then we all were negative. And then he said, well, what happens like in 2 weeks if someone else gets it? I'm like, well, we might have to consider doing the test again. And he said, this is like a never-ending cycle of confusion. And like,
that was funny.
That was so hilarious.
Yeah, that's a good quote. I like that.
That's a good quote. I wrote it down.
Yeah.
But yeah, I mean, it's one of those things where, it is frustrating, but it is what it is, and we try to do our best to figure these things out.
He pulled up his actual. I thought you were pulling up your to-do list for later.
No.
It was getting it for the quote.
I wanted to get the quote right.
Okay. Do you write down my quotes ever?
No.
Okay. Apparently not as exciting. Tina has a great question about how do you politely address if you're going into a medical office and they're not wearing like a doctor's office, they're not wearing masks and they're not taking temperatures. Super interesting. My daughter had to have orthodontics treatment because of a bunch of stuff went wrong. Of course, during COVID. And so when we got there, now they have this brand new protocol where we go to the door and they put on a temperature, or they take our temperature, they write down whether or not we've had any symptoms, and then she's allowed to go in. Only she has to be masked, which is with orthodontics is weird, right? But she's allowed to go in. There's a waiting area that has like 2 separate areas. Like, it's very organized, and they have basically, I would say, kind of a guard, maybe not a guard, that sounds a little too strong, but somebody who kind of facilitates that experience and wipes everything down and has like that. So I feel very safe in that situation. So I think that maybe in those situations, I've had other clients of mine say that they went in somewhere and nobody was wearing masks, that they like basically like were sharing pens. They didn't have any like visible like cleaning out.
That's going to be a personal decision. Like, do you feel comfortable? And if not,
well, I think that if you're in a doctor's office and you say, our family is following the guidance of our doctors who state that we should be masked and we should be protective and doing these things to protect ourselves. And if they're not, I think that I would mention it to them. And if it's not corrected or if it's not comfortable, then I would have a conversation with your primary doctor, the person who you rely on, and say, how would you handle this in this situation? But I think it's fair to go to them kindly and say, have you changed your protocols in these situations, and in what way? I did that at the gym that I went to, where they had me sign something for training. We went in one time, and the guy said, you need to sign this COVID waiver, which apparently waives all liability if anybody gets COVID. And I said, well, what is your protocol and process? And the poor guy behind the desk is like, well, I'm wiping it down once an hour. And I looked at him and I said, like, with that, and he had like this little, I don't even know, like generic little wipe things, and not that brands, matter or whatever, but it was like, there's no chance that this like 17-year-old kid is like taking care of this entire private gym. Yeah. So we just made the decision that we weren't gonna participate in that setting, because we wanted to make sure on that day. And then my daughter said, I think I can go back and I think I can do this. I'm not touching the equipment. I really like this trainer. It's in a different area. So, and I had a conversation with them and just said, look, I've got some concerns about whether or not these are being followed. So I don't know. I mean, I think that, grace, kindness, have a little bit of patience. I think it can be helpful.
Just be honest and assess your risk on your own. I mean, that's what you have to do.
Yeah. Our friend Joe from Texas has popped in to say hi. So you want to talk about like summer travel plans at all? Like, what are your thoughts there?
Plans, I mean, so yeah, obviously, there's been I've had some patients that stay here and go somewhere else for summertime, and there are some restrictions. I mean, some are like in Texas, I think one of my patients had to get tested before they entered the state.
Like in the airport?
I can't remember exactly, and then another patient was in Delaware, I think, same thing. They had to do some testing before they entered the state, which I think, so that's going to change summer plans. I mean, obviously.
Well, it might be just like the temperatures in the airport. I know some of the bigger airports were doing that. I know that
But that's changing plans. I mean, I think our plans have changed. We were going to go off and about, and I think now we'll just do some maybe more local trips, and maybe short trips, maybe explore things in Arizona.
Well, and I also think that the psychology of a pandemic is wearing on everyone. And I think that no offense, like spending the same amount of time with the same people all the time, when you're used to being like out with other people. Yeah. We talked a little bit about introverts and extroverts and things like that. I think that if you can take this summer to look at the opportunities of, your children will never probably have this much exposure to one another in a set amount of time. Families certainly don't. There's a lot of people that are struggling with that. I think finding that silver lining. I'm always the one who's talking about the rainbows and the rain clouds, but like finding the rainbow in that situation. And again, I think there's a lot of super cool places in Arizona to explore. We've got some cool lakes, and even though it's sometimes 1,000 degrees outside.
But I mean, go up north.
Or you get up really early. I mean, it can't be too hot at 5 a.m.
Not too hot. No, 97.
Yeah. You wanted to talk about
school openings.
Okay.
Is it safe for my kids to go back to school? So I've read, I'm sure she's read too. Having class sizes will be less than 12. I mean,
well, it's going to come out Monday in Arizona. Yeah. So for all of us here, they're going to be releasing kind of that staged statewide plan of how they initiate it. But I'm going to talk about.
Yeah, the presumption is, Denmark are already reopened. They seem to say under 12 kids weighs the balance of, impact on your home and family, and getting kids back into the kids back into school and adults back into the economy working. And open calendars, and maybe no sports or no huge gyms or assemblies. Who knows what it's going to look like in Arizona?
Yeah, I mean, your children might need masks, so I think that it's like prepping to like make sure that they're used to like doing that if they're going to have to do that in the school. I can't imagine they wouldn't require it in the school setting.
Yeah.
So maybe taking some time over the summer to figure out like what's comfortable. If you need to like make them yourselves, I don't recommend it. Having done it for a charity project, which I got, by the way, 2 hours of donation time. It took me like 10 hours. Or maybe that just says I'm a bad seamstress. I don't know. But I think that when they go back into schools, like give your kids power, empower them to understand like they can have their sanitizer when they sit down. They probably should have their own wipes. Like everything is going to be a little bit different. I think some of the old
prepping them, I think is good.
So practicing maybe at home and giving them some experience. For us, like if we're going into remote like work environments or leaving our remote work environments and going back into the office, I think having your set system of like where you go in and kind of wipe things down. I know I borrow his office, so I went in actually the other day and I was like, oh, I don't know what I can touch or not touch because I don't know how clean you are. Like
I'm pretty clean.
Okay. No. Well, in terms of like sanitizing the desk area.
Oh yeah.
And you're like, anyway.
Anytime I leave or enter the room, it's always washed. Yeah. My hands are super dry, so.
Is that proof?
That's because of alcohol. Yes.
Okay. It looks like we had our friends were going to come back from Spain to come visit in August, and the airlines are refunding tickets. So it sounds like that again. Like we're not probably going to be able to get out there and and do kind of the travel that we're going to.
It brings up a point on looking at fatality rates and numbers and recovery numbers and new cases. I think the number that everyone should be paying attention to is the R naught, which is telling you how many people are going to be infected. So if I get a virus, if I get SARS and the R naught's 1, then I'll probably just infect one person. If the R naught
stand for?
It's a measurement of infectious.
Okay.
If the R naught is over 2, that means I will infect 2, and obviously the pandemic will then explode. So if you can pay attention to one statistic, if you have to, it'd be the R naught. If that R naught remains under 1, then obviously we're going to see less and less cases. And so that's the number if you're going to pay attention, versus case fatality rate and numbers of cases, because there's more testing. It's the R naught. So just a little nugget there.
Maybe you just like pop on it. Like
R0. It's called R0. So if you look for it, it's R0. It's called R naught.
But then it would be 0.
No,
so the R0 equals 1.
The naught is 0. The 0 is a naught. So it's R, the letter R with a 0. That's the R naught. Equals whatever 0.7, 0.9. That's what we're going to look for.
Very confusing. They use the 0.
I know, but it's that's what it is.
So
that's science.
This is how Bill and I met. He was my math tutor in high school. But that would be confusing to me. But maybe you could just pop on and tell everybody. Maybe that's something you could like.
Yeah, that's what I'm going to be paying attention to, is the R naught versus, again, for one of the first questions was cases are rising, why, and really, obviously right now, hopefully it's just testing and not necessarily more cases of it.
Yeah.
So.
But I think in Arizona, we're in good stead. Like, I think that, again, summer plans, practice some of these hygiene stuff with your kids. Talk to them a little bit about, like, if you see other people doing things that are different. When the kids were really little, if I saw somebody who I thought was kind of shady or maybe uncomfortable, I would call it a tricky person, because I always thought stranger danger was, like, a terrible message, maybe because of the milk carton thing that traumatized me as a child. But anyway, tricky people. And so I think that observing other people, and if they're acting like angry or hostile or frustrated or things like that, it's like just giving them that overall impression. I kind of walk through that world. That's just kind of who I am anyway, just like globally always paying attention to stuff. And so maybe that's a little bit more important nowadays, is to kind of pay attention to whether or not somebody wants a bigger berth versus like somebody who's like getting in your space and isn't like giving you that 6 feet. If it makes you feel uncomfortable, maybe back to Tina's issue, how do you kind of tell somebody and say, you know, it looks like you're in a hurry. Did you want to go?
Yeah.
Particularly if they're sneezing into their shirts, you know, things like that. So, but I think that again, from my side of it, it's like the psychology and the patience and the care and concern for others. If we're showing that for other people, I think that they will show it back to us, and that's really how we're going to get through this all.
Yeah. I think one last correct. Where do you find a reliable R0? I would go. I have this website. It's called 1440. Let me see if I have it. If you type in coronavirus 1440, they have a ton of articles there. That's the only place I've reliably found an R0. So I would just refer you to that site. But it is hard to get numbers on those. Yeah, difficult.
Yeah. Well, again, maybe that's something that they can kind of pop into, or you could post into the Facebook thing when it comes up. So if you're part of this community, that'd be kind of helpful.
Yeah.
I mean, you don't have to go on camera every time.
Yeah. And that number changes depending on where you live. I mean, New York, it was crazy high, you know, Arizona. So it's not going to be a U.S. number. It's going to be a Maricopa County or Phoenix. So you have to really, you know, focus on where you live and what that number is. Or if you're going to travel somewhere, you may want to know that number too.
Oh, good point. Yeah, that's a really good point. All right. Well, is there anything else that you think we should talk about?
I think we covered. No more questions.
But he's got lots more statistics here.
I don't want to confuse you.
Yeah. Well, I get confused very easily. Stay safe. Like, try to enjoy your summer. Try to be good to one another. And I think, again, like, know that this is not going to be a forever thing where we're going to be in pandemic state. I think that we will get into a position where we're in a better place, but it's going to be more of a marathon than a sprint.
Absolutely.
Is that a fair statement?
Absolutely.
Okay.
All right. Signing off.
All right. Bye, everyone. Bye.